Ashley Kleinert. I'm one of the school nurses, and I'm going to talk to you about concussion management today. Who is this training for? This is for everyone in the school that interacts with students. Our objectives today are to know your specific role when it comes to concussion management, understand state and district policy, understand the definition, signs and symptoms of a concussion, and we want to make sure that you know who to contact in your school if you have a student with a concussion or a question about a concussion. So the North Carolina State Board of Education has a specific policy for concussions. It includes developing a plan for addressing preschool through 12th grade, so that's all students. The plan also includes guidelines for removal of a student from physical and mental activity when there's suspicion of a concussion, notification procedure for staff, expectation of medical updates from parents and accommodations, and the requirements for return to learn and return to play. The plan also states that there should be a concussion management team, and we'll talk about that in more depth in just a little bit, and an annual training for staff and a health question in registration that addresses previous head injuries and concussions. So what is a concussion? A concussion is a type of traumatic brain injury. It's caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. Signs and symptoms of concussion tend to fall into 4 categories: physical, cognitive, emotional, and sleep. And those signs and symptoms may be noticed right away, or it may take a few days for them to develop. What are some causes of concussions? Well, sports is probably the one that you're most familiar with, but it could also come from motor vehicle accidents, a fall, or collision. So why is this important? 15% of United States high school students report having a concussion, so you're likely to encounter this. Recovery looks different for each student. Sometimes they just need short-term academic accommodations to recover, and sometimes it takes a little bit longer. So your students with a history of concussions, migraines, headaches, ADHD, anxiety, and depression, sometimes it makes it harder for them to recover. So concussion management team, this is a multidisciplinary approach to care for a student with a concussion. And this is both state board policy and Morsel graded policy. So who is involved in this team? We're going to go through this one by one. So the teachers, and the teachers are the first one we're going to talk about. They spend the most time with the students during the day, and they know the student the best. And unfortunately, school is a hard place to be if you're recovering from a concussion. There's bright lights, lots of noise, screen time. You are using your brain to learn and retain new information. And we are most likely going to see changes in our students at school. So teachers can be on the lookout for changes in the students' behavior or academics, and it's important that the teachers are in tune with the students and how they're doing with recovering in the concussion and communicating that back to the team, including communicating that with the parents. PE teachers specifically, make sure you know your accommodations for PE, because lots of times these students are not to do PE or recess, and we need to avoid further injury. So school psychologists and school counselors, they're there to help with services and resources, 504s, IEPs. Typically, we don't do 504s for concussions unless they need accommodations longer than 3 weeks. So admin, their role here is going to be to be included in any schedule changes and make sure they approve that, just keep them in the loop with that. An example is if a student needs to eat somewhere different than the cafeteria to help them recover, then your admin needs to sign off on that. The school nurse is responsible for periodic monitoring of the students, the symptoms, communicating with the parents, and making sure they have the right paperwork on file. There are times when the nurse may have multiple concussions at one time. The student, we need to talk to the student. We need to see what's working well with them, what they're struggling with, how are they feeling. We need to be in communication with them. parents and guardians, if we notice specific things that the student is struggling with, we need to communicate that with them. We can also communicate things that are going well, things that they don't need anymore accommodation wise. And in my experience, parents don't have a good understanding of concussion management, so this is important to include them. Other caregivers is going to be, examples are before and after school care. So if you have a student that's going to before and after school care, make sure those teachers are included on the concussion plan. School coaches, so if your student is a school athlete, their coaches must be informed about the concussion. There is specific return to play paperwork that has to do with athletics. On the same line, athletic directors, athletic trainers, and first responders also need to be included. So the physician and the healthcare provider, those are going to be the folks that monitor the student with a concussion diagnosis. They are going to guide the removal of academic adjustments and supports throughout this process. So if a suspected head injury occurs at school, this is what we would do. So any Mooresville graded school district employee that suspects a student has suffered a concussion or head injury should immediately remove the student from that activity that could cause further injury. So if this is at recess, PE, athletic games, ROTC, anything like that, even just in the classroom, we need to make sure that we remove them for further injury. So this could look like two different things. It could look like an emergency situation, and in that case, we don't want to actually move the student. And this is life-threatening signs and symptoms. This is what you're going to look for because it could be a possible head, back, or neck injury, and this needs to be a process where you activate the emergency response at the school level, and EMS should be called to take over. So examples of this would be changes in consciousness, severe pain, pressure in the head, neck, or back, tingling or loss of sensation in extremities, partial or complete loss of movement in a body part, unusual bumps or depression in the head or over the spine, blood and other fluid in the ears and nose, heavy external bleeding, seizures, or impaired breathing as a result of the injury. Again, all of that is an emergency situation. You need to activate your emergency response within the school. If none of that's going on, the student is safe to move. They need to go directly to the nurse, where the nurse will assess and communicate with the parent guardian and move forward in the proper channels. So concussion symptoms, we're going to look at several different types. This first page is looking at thinking and memory symptoms. So a student may find difficulty learning new information. It may take longer to understand or comprehend. They might have difficulty with multi-step problems, thinking clearly, and making decisions. They may have trouble paying attention. They feel slowed down or foggy. Physical and sleep-related symptoms are going to be probably our most common complaint, which is headache, vision changes, unable to concentrate or feeling distracted in bright, noisy environment, feeling more tired than normal, maybe some nausea, sleeping more, sleeping less. Other symptoms can include emotion, mood, and behavior. These aren't talked about quite as much as the physical and cognitive symptoms, but this is something that you could see. So the student may be more irritable, frustrated, have trouble controlling emotions, maybe having less patience than normal. That is a sign and symptom of a concussion. So if a student is diagnosed with a concussion, this is what our plan's going to look like. So look at that first bullet. It says whoever first receives the concussion information about a student needs to pass that along to the concussion contact person as soon as possible. So most likely this is your attendant, your data manager, your front office folks, parent emails the teacher. If the teacher gets an email, you need to make sure you send that information to the nurse or the concussion contact person right away. At the elementary and middle school level, the concussion contact is the school nurse. At the high school level, it's a little bit different. The concussion contact person is going to be the school nurse, but we also may have the athletic trainer involved, especially 100% if it's a student, if it's a school athlete. The concussion contact person will notify the teacher and any other personnel that's appropriate. We talked about that concussion team. And they will take the accommodations from the doctor and distribute them to the staff that need that information. As updates come in, we'll pass along new information. So classroom accommodations, you'll have doctor's orders that will give you some specific accommodations. This is a really long list. I'm not going to read them all, but I'm going to point out a few that might be helpful. And even though you have physician orders, these are also some things you can do in the classroom to help with that return to learn process. So you may need to adjust the student's schedule, give them breaks. I think that that's probably the biggest thing, is just give them a 5-minute break, every 20-30 minutes. Let their brain rest for just a little bit. Reduce distraction, so noise, lights, maybe turn a light off in your classroom. Let them work in the hallway if that's an option. Seating requests, extra time on assignments. Decrease the number of problems or questions they have to do. So if you have 20 questions, have them do the even number. Whatever is appropriate that you can still gauge their understanding, but it's less work for them. Help them take notes. Have a student take notes for them, or give them a copy of your notes. Break the assignment into chunks. Eliminate assignments versus extending deadlines, because a lot of this work can build up. That can cause anxiety. If you can eliminate something, that would be great. And remember that these are only temporary. Lots of times I said within 3 weeks, this student's back to their baseline. So it's going to be a pretty quick turnaround. So you would get a paper that looks similar to this. Mooresville Graded uses the North Carolina High School Athletic Association form. We do this for a couple of reasons, but the biggest one being student athletes have to have this paperwork filled out, and they were having 2 packets of information, the nurse packet and the sports packet. So we said we'll just combine it all down into one form. So even if you have an elementary school student that's obviously not a high school athletic student, it's okay. This is the form that we're going to use to help us streamline that. Pay attention to testing. There are doctor's orders, and if it says no standardized testing, you need to talk to your testing coordinator and figure out what you need to do for that. All right, I'm going to show you a quick video, Dion's story, that kind of sums everything up.
I got a concussion last month after tripping and falling down the stairs. When I got back to school, I had a hard time remembering things. I even got in trouble for cutting class. I didn't mean to cut, I just didn't remember when lunch period ended or where I was supposed to go next. I was so frustrated and embarrassed. Luckily, my homeroom teacher, Mrs. Keene, noticed what was happening. She checked in with me every day and worked with my other teachers to help me. A team of people stepped in to help, and Mrs. Keene let me have lunch in her classroom and helped me remember my schedule for the rest of the day. Then all my other teachers followed Mrs. Keene's lead and found ways to help me out. I'm so glad Mrs. Keene noticed something was off. She really made a big difference. I still get headaches, but I'm feeling more like myself. And my grades are getting better.
All right, so please pay attention to our students suffering from concussions. You are the eyes and ears of them in the classroom and at school. And if you have any concerns or questions, please reach out to either the parent, guardian, and or the school nurse. Thank you so much for your time and attention on this topic. If you have any questions, you can ask myself or you can reach out to your school nurse. Thank you so much.